Assalamualaikum and good evening to Sir Fuzi and my friend. Today, my group would like to present about Department of Hospital, which is medical imaging X-ray machine. This is our group member. Name of student is CHEELIAA SILUN, Maisarah binti Muhammad, UMAIRAH binti ZAMRI, and myself, TENGKU NURASHIKIN binti AZMAN.
Hi, sir.
The first presenter is CHEELIAA.
Good evening. So I will start this presentation. First one is introduction. So technology is something that makes our everyday life easier and more productive. For example, like students have assignment and they use technology like use AI to do their assignment. So this is can make the student to make the assignment easier and more productive. The second is technology can also be entertaining. For example, like student student answer the quiz from their lecturer. So this is can make the student fun and excited to answer the quiz. So next, scientists scientists are the only one who invent things, but people who have good idea can also invent useful things. Next slide. This is the example of X-ray. So you can see this is the picture that show the example of X-ray. Next. So this slide I will talk about history of X-ray. X-ray were discovered in 1950 by Wilhelm Conrad Roentgen, who received the first Nobel Prize in Physics in 1901. So you can see this is the picture of Wilhelm Conrad Roentgen. Next, the several important discoveries have been made using X-ray. These penetrating rays also used in many applications. Next. So you can see this is hospital typing on 1897. First machine in Asia was placed in hospital typing on 1897. Thank you.
Next slide. How medical X-ray used in hospital. X-ray use invisible electromagnetic produce image in internal tissue, bones, and organs of film or digital media. Many reasons, including diagnosis tumor, burns injury, incident, can use using X-ray machine. X-ray are made by using external radiation, which is radiation ni dangerous in soft tissue in the body such as blood, skin, fats, and muscle. Allow mass of the X-ray to pass through and appear dark gray of the film on digital media. Next slide. Function of X-ray machine in hospital department. The machine X-ray used to detect bone fracture, certain tumor or other abnormal mass pneumonia, some type of injury, classification for against object or dental problems, which is X-ray need can detect which fracture patient to other fracture. Something that need to avoid on X-ray machine is which is pregnancy woman, baby, because it is radiation dangerous. Radiation during pregnancy may have to but the effect which is baby. Radiation that has to the potential to harm living tissue. Next slide. Some other device on X-ray machine. In X-ray machine, the device also have VDR Smart, a X-ray system that is easily installed in limited space and easy to use. General X-ray system, ResNet series, the X-ray system to be installed in the radiology room. And X-ray machine also use coding system, and a focus cup is used to concentrate the stream of electron to a small area of the anode called to the focal spot. Next slide. Next presenter.
And now I'm going to talk about the benefits of X-ray in public and community. Number one is the determining surgeries. By providing accurate diagnosis, assisting with treatment planning, analyzing risk, allowing minimal invasive procedures, and encouraging patient awareness for well-informed decision-making, surgical decision can be made. This means because of X-ray that gives an accurate to do surgeries on patient, it gives the patient more aware of the surgical procedure that will happen to them during surgeries. The second benefit is reduce exploratory surgeries. Reduce the number of exploratory procedures by providing surgical options, measuring risk, accurately diagnosing conditions, carefully arranging treatment, and operating efficiently throughout the procedure. This means because of X-ray, patients do not need to do a surgery to diagnose their sickness, to diagnose their symptoms or tumors. Because of X-ray, they can know just through the X-ray what is wrong with their body. So the patient do not need to be in surgery more than once to determine their tumors or anything inside their body. So the third one is improve cancer diagnosis. Improve the diagnosis of cancer by early and identification, accurate tumor location, and efficient treatment scheduling. They support reliable biopsies, track the course of diseases, and help with the cancer stage. It means that because of X-ray, it can determine tumor accurately with no mistakes to do a surgery. The last one, the fourth, is reduce hospitalized length. Through reducing minimally invasive procedures, accelerating diagnosis, enabling focused therapies, preventing pointless testing, reducing care pathways, encouraging early discharge planning, and promoting postpartum monitoring. This means because of X-ray, the patient will have less hospitalized days because all the treatment and being cured are all organized by the hospitals. Next slide. These are the questions we made through Kahoot. The questions are all related to our topics on the X-ray and our slides that we made. We made 10 questions and 10 people answered this Kahoot question perfectly. Show all the slides. These are the questions all related to the X-ray we made. Next. And everyone answered it very, very good. Only one pupil have struggled with it, but it's fine. These are the all participants' name. Okay, that's all for the Kahoot question.
Okay. The next slide is the negative side effects of medical imaging or the X-ray. Okay, while X-ray are linked to a slightly increased risk of cancer, there is an extremely low risk trusted source of short-term side effects. Okay, exposure to high radiation level can have a range of effects such as vomiting, bleeding, fainting, hair loss, and loss of skin. So it's can affect physical and genetic, you know. Next is the negative side effects is more radiation in the body may lead leukemia. Okay. The next slide is positive side effects. Okay, this is very interesting. But X-ray provides such as low dose of radiation that they are not believed to cause any immediate health problem. Okay. The benefit is the fact that X-ray have been used in medicine for such a significant length of time show how beneficial they are considered to be. Although an X-ray alone is not always sufficient to diagnose a disease or condition, they are an essential part of the diagnosis process. So, some of the benefit is non-invasive. An X-ray can help diagnose a medical issue or monitor treatment progression without the need to physically enter and examine a patient. Number 2 is guiding. X-ray can help guide medical professionals as they insert catheters, student or other device inside the patient. They can also help in treatment of tumor and remove blood clots or other similar baggage. So the next is unexpected find. An X-ray can sometimes show up a feature or pathology that is different from the initial reason for the imaging. For instance, or for example, infection in the bone, gas or fluid in area where they should be known, or some types of tumor. Okay, so the conclusion is, this is my conclusion, balancing benefit and risk. Okay, to help reduce risk to the patient, all exam using ion zinc radiation should be performed only when necessary to answer a medical question, treat a disease, or guide a procedure. If there is a medical need for a particular imaging procedure and other exam using less radiation are less appropriate. Then the benefit exists. The risk and radiation risk consideration should not influence the physician decision to perform the study or the patient decision to have the procedure. So that's all from me and my group. So you guys wanna add something?
Nothing.
Nothing?
Okay.
Tengku, do you wanna add some advice or something?
No, I think no.
So that's just from us. Thank you for watching, and thank
Thank
you
you, sir.
answer. Bye.
Thank
Thank
you.
you.
Bye.
Okay. Bye.